All right, which of the following is the most appropriate screening recommendation for this patient? Okay, so 30-year-old man, he has confirmed NF2, presenting to his neurologist for a routine follow-up. He has history of bilateral vestibular schwannomas and multiple meningiomas. His hearing has been stable, and he denies any neurological symptoms. So the following is the most appropriate screening. So NF2, like, yeah, you get the bilateral vestibular schwannomas. I can't remember if there are any other um like syndromes, I guess, associated with NF2s that I would need to like screen for specifically. I don't know. I mean, annual EEG doesn't really make sense. I mean, you're not going to see anything unless they're actively going through a seizure episode. I'll rule that out. Um, Annual abdominal ultrasound. I don't think there's any abdominal manifestations of NF2. Um, and then so down, do I want to do an annual brain MRI, spinal MRI, or a ophthalmologic evaluation? I mean, vestibular schwannoma, if I'm thinking about this right, you get, hearing loss, like a lot of CN8 issues can extend to involve like trigeminal and facial nerves as well. Um, I mean, do I want to do an annual brain MRI to see if the lesion is progressing to like,
So clinically, you're thinking through everything fine, right? I just need to try to get you to the next train of thought, right? And be confident in your train of thought. Of course, I know the answer because I have to know the answer, right? Because as an ENT, I have to know kind of what you want to do here. But what do you want to do in this particular situation?
I can't remember if vestibular schwannomas have any ophthalmologic sequelae, but I don't think so because I mean it's involving the inner ear. You're not gonna see any eye. It's not, I mean, it's still close by, but not, I don't think that would be the answer. So I'll just go with the brain MRI.
Yeah, this makes the most sense. Okay. You knew everything, clinically, pathologically, right? Anatomically, right? So you got to pick the answer that fits with your clinical understanding of vestibular schwannomas, right? Don't go down a deep, dark path, right? You just told me that it can potentially, cause mass effect on the facial nerve, the trigem nerve, right? And you would want to know if it's growing rapid or slow, right? Because that's going to end up changing your management. You get what I'm trying to say?
Yeah.
So if it's growing fast, and I can't remember, there's definitely a criteria for what is considered fast. I can't remember how many millimeters per year annually. But then you might have to, you have to tell this patient, hey, this could potentially not only affect your hearing, but also, could, affect how your face moves, right? Or how you feel pain or things like that. So do we have to, do a surgery to take it out? Right, with neurosurgery, right? ENT with neurosurgery, or do we have to do stereotactic radiation, right? So all these are all conversations, right? That you're going to have based off of how big the mass is every year, how much it's growing, right? And that's going to dictate how you're going to proceed next. But if you don't do an annual MRI, right, and you just base it off of symptoms, then you might be behind the eight ball. You get what I'm trying to say? Because once you have symptoms and that thing is big, right? You know what I mean?
Yeah.
Yeah, things to think about. But good. I think you knew everything you needed there. Just need a little bit more confidence and like, so don't make a stretch. Don't pick an answer choice that's a stretch. You know what I'm trying to say?
Yeah.
So if you pick an opto exam and you get it wrong, then my question to you is, how would you support that? You know what I'm trying to say? You told me that it deals with the nerves, it deals with this, but you never said anything about vision. So you shouldn't be leading yourself towards that, So